I've had to look for my research collaborators because, as I said before, there are very few nurses who are have taken on the task or the challenge of studying patients' response to atrial fibrillation. So so depending upon the topic of my study, I have chosen collaborators who have perhaps studied these topics in patients with maybe coronary artery disease or heart failure, because there's a lot of studies about the cognitive, behavioral, and emotional responses to those illnesses. And in some cases, we have designed our studies similar to those, but realizing that they may we can't just generalize the information that we found in those studies to patients with atrial fibrillation. Otherwise, we wouldn't even conduct the studies. So my latest collaboration really is with Dr. Holly Devon, who is from the University of Chicago, and she has studied delay in seeking care for symptoms of acute myocardial infarction or acute coronary syndrome. There are other researchers who have done that as well, but Dr. Devon has been particularly interested in my work with atrial fibrillation, and I have found her to be an excellent mentor for me. She has mentored me on a Midwest Nursing Research grant that I was fortunate enough to receive, and has now mentored me in the application of a training grant for the NIH. And I am hoping to collaborate with her a little bit more in the future. One of the things that we share in our collaboration is the theoretical framework for our research, which is Leventhal's common sense model of self-regulation. And so it's not too big a jump to go from one illness to the other when you have this framework and this theory to guide your research. Well, I hope to extend the study that we did in terms of the identifying the factors that were influencing patients' treatment-seeking delays. We now know the factors, so based on the knowledge of some of those factors, we have developed an instrument that actually identifies those beliefs the patient has about their symptoms and about atrial fibrillation. And in our next study, we will use that instrument to identify a patient's particular individual beliefs about atrial fibrillation and about symptoms of atrial fibrillation to modify those beliefs and educate the patient specifically to their beliefs. We hope in doing this we will be able to increase their knowledge about atrial fibrillation and symptoms. This will be done in patients who do not yet have atrial fibrillation but who are at risk for atrial fibrillation. And in so doing, we hope that we will not only increase their knowledge and their appropriate beliefs about atrial fibrillation, but we will increase the likelihood that they will seek treatment early, and then in so doing, hopefully prevent such devastating consequences as a stroke or heart failure. But that study will be, we hope to pilot the intervention first to see how well it works, and then if it works, we will then extend it into a larger study and seek grant funding for that.